So let's say you're at the gym, you're performing pretty well, you're going for a squat, you're going for PR, or perhaps you're, I don't know, performing in a sport of some sort, maybe football, basketball, whatever it may be, and you get hurt. It's not necessarily a broken bone, but it could be like a muscle strain or a joint sprain, but it's stopping you from performing at your best level. Or let's switch that up. Let's assume you're just a general person competing in this game we call life, and you have a pain in your ow. So what do you do? What is pain, and how do you go about reducing or limiting the symptoms of pain so that you can go about living your life? Welcome back, folks, to the Mental Rep Podcast, a district podcast where we talk about all things pertaining to training, recovery, training, nutrition, and recovery. I'm your host, Jorge Diaz, and today I do not have the usual gang. Today I am honored to be hosting my friend, my mentor, and coach, Dr. Michael Soya.
Thanks, man. It's fun to be here.
Dude, it's your first time here too. What do you think about the district?
It's very cool. Like I said, this is such an awesome space for one-on-one small group training. I mean, you guys have excellent equipment, from the comp plates to bumpers for both pounds, kilos, etc. A lot of great cardio equipment. It's a really nice space.
Thank you. Yeah, Dan and Scott really hustled to put together a good environment that meets all the needs of our clients. So, but today, we have you here. So for the audience that doesn't know you, I know you're really humble. You don't like to talk about yourself. So speak of yourself in a third person and tell me about Dr. Michael Soya, as if it's not you, it's just the third person.
I think I could do it.
Okay.
So I graduated from University of Sciences, which is now St. Joseph's University, back in 2015 with my doctor of physical therapy. Since then, I had worked 2 years for a large private practice in New Jersey, and I hated every waking moment of it. I wanted to quit my first week, but I'd stuck it out for 2 years because I wasn't sure if I could actually go out there and do this whole thing on my own. And in 2017, in January, my wife, she and I were just dating at the time, we happened to walk into Adelante Barbell Club within the first 2 weeks it was open, and I just thought, wow, what an amazing space. It's dedicated to powerlifting and weightlifting. There was almost no accessory equipment in there at the time. It was just racks and 2 deadlift platforms and a couple weightlifting platforms, and that was it. It was a nice bare bones space, and immediately I thought, wow, this could be it. This could be the space that I start working out of a gym, doing my own thing and actually doing what I want to do, instead of having to essentially almost give a formula for how to treat patients. And so over time, I started to talk to Mike Adelante about this. And he was like, I think that'd be great. I think that'd help me out, because then we have a PT on staff, which would be awesome for me. And it'd help make a great sales point to, prospective clients. And so in August of that same year is when I officially started getting my stuff together. And then at the end of the month of August, I left my full-time job and I started Soya Physical Therapy LLC full-time. I went all in on it.
Woo! Can we get an applause button?
And what was also equally terrifying was, at that time, Danielle and I had just moved in. So I've got this girl that I've been dating for less than a year at this point. We're just moved in, and I'm like, hey, I'm going to leave that job with a predictable salary and everything and try to hack it out on my own here.
Wait, so you're telling me that there's an ugly side to this sexy entrepreneurial thing?
I'm telling you that starting out, I kind of had to pick what food I absolutely needed to survive and not just, what sounds good to eat this week. And, you get very frugal very quickly. You're really able to look at what is the bare minimum amount of money I need to survive and live under that at times if you have to.
And just recently, you mentioned a major feat that you experienced when Adelante was expanding. Mm-hmm. What was that? Could you mind giving some insight on that?
So in just this past year, we moved into a much bigger space. And so I went from, at the very start of things, I didn't even have a dedicated space in the gym. So occasionally I'd have to ask people like, hey, do you mind moving aside? So I go up to my treatment table because I have to evaluate somebody for a first session. And so we went from that to having a dedicated space that would still be invaded once in a while despite signage and everything else, because, you know, people are too self-important or they can't read or a mix of both. So we went from having just a little dedicated space in the open gym to then actually having a legitimate, large, pretty office within the new space of Adelante Barbell Club. And with the growth of the gym has come new members, which has in turn gotten me some new patients as well, which has been awesome. And then, you know, the growth of my business has been interesting too. Again, going from months of just like, oh my God, I only have 5 sessions this week. Like I'm barely making 500 a week. What do I do? To, you know, having 30 plus sessions a week pretty consistently now. And some of that's too just by nature of how I myself have changed too. You know, in 2019, I stopped competing in powerlifting, and we can go into my history on that too. But at that point, I started taking up Brazilian jiu-jitsu, and that's introduced me to a whole untapped community of people who just get so frustrated because, again, you go to the doctor with an injury that you sustained on the mat, and the advice that you get is always, oh, well, just don't do that thing that, you know, you spend all of your time and energy thinking about and doing. And people don't like to hear that.
Yeah, I think that's funny that as a person who largely deals with injuries, either in joints or musculature, that's just the way I perceive it. That's not exactly how a physical therapist field is. But I guess that's a question for a little bit. But as somebody who largely deals in that field, you got into a sport where the main goal is to dislocate or dismember. I think that's funny.
Well, I mean, you put people in a position where they choose whether or not you,
with consent,
you do that. Exactly.
Yeah.
I mean, you put them in a position where they choose, do I let them tear my shoulder off or do I submit to him and he now lets off all that pressure? I mean, if you've seen me roll, you know I give people nothing but time. Like I'll kind of hold near end range and I'll let people decide, you know, are you walking home unscathed today? And thankfully, most people are usually smart enough to be like, oh yeah, I don't want to, you know, have my shoulder torn off here.
That's funny. I think you made a mention of a partner of your, a rolling partner, a Brazilian Jiu-Jitsu partner of yours that rolled with you exclusively because he knew you wouldn't take it too far.
Yeah.
Unlike a white belt.
Right. Yeah, I mean, it's funny to, again, have gone from essentially being everybody's restaurant because, again, I was an out-of-shape power lifter who never grappled, and I was, quite frankly, terrible at it, to becoming the guy that was then like, oh, yeah, he's okay, but he's just strong, to now, oh, he's very technical and sound. And so I become a safe role, and I'm very open to just kind of matching the intention, the intensity of what I'm being given back from the other person. So if somebody wants to go light and really just work technique, I'm happy to, you know, take the edge off things and really let them do that. But if you have somebody that's just a hothead and they're like, I'm getting after it today, I'm like, okay,
yeah,
we can do that.
Yeah. And I don't know if you mentioned, but what degree belt are you?
I just got my purple belt a couple weeks ago, so it's pretty exciting. It's essentially the halfway point to black belt in terms of just looking at pure rankings. You know, it's white, then blue, then purple, then brown, then black. And throughout, there's stripes awarded to many schools. And
how long has it been since you first stepped on the mat?
A little more than 3.5 years now.
Is that fast? Is that like...
It's a little faster than normal. Typically, like a purple belt will usually be about like a full 4 years or even like 5 or 6 is uncommon to get your purple belt at. Yeah,
that's insane. Your IQ on the mat has substantially increased that last time that we rolled many months ago.
Yeah, over a year and change.
Damn, I can't believe it's been that long.
Yeah.
Let's take a lot of steps back. Number one, what is physical therapy? How would you define that?
That's a tough one because, again, people have these notions about what they expect from it based on their prior experiences or what they've heard about it. And I think a lot of people imagine the typical large corporate or hospital outpatient facility where you're going in, you're seeing this therapist for like 10, 15 minutes, and a lot of times they do a lot of manual hands-on work with you, and then a tech sets up a bunch of exercises for you and you go through it kind of unsupervised, and it's almost too easy most of the time. And that's essentially what I had done. Was I was in that kind of setting for 2 years. You're doing a lot of unnecessary things. You know, we can make a case for manual therapy being a nice adjunct to good exercise dosing. But on top of that, you know, you're asked to do stuff like applying hot packs and electric stim to people and other things. I'm like, sure, it might make somebody feel good for 5-10 minutes, but there's no lasting benefit of this. This isn't speeding up their time to actually get back to what they want to do and do the nature of me seeing for these people at a clip, you know, like within the same hour. I'm not able to really give them the attention they need to get back to what they want to do. I can't look at, are they able to squat a certain percentage of their max and handle that without any issues? Or just look at technique breakdown. I could be like, hey, I think if we optimize this a little bit, it might be a little bit more comfortable in the short term. And then as we get farther out of the woods, you can start to go back to what you normally do. And you're just not given that time. So for me, when I look at what I do as physical therapy, is that I almost look at it like training, except we're getting a little bit more specific to a certain region of the body, whether we're getting hyper-focused on a specific joint or just a limb in general. The same principles of training apply, where again, I'm looking at where's our entry point into starting to introduce exercise? What is going to be tolerable enough? And then how do we ramp that up to what you want to do in the long run here? And that's going to be dictated by, again, what's your current state, how irritable are things? And then what is my activity that I'm looking to get back to? Am I looking to get back to squatting 650 pounds? Or is it that I'm looking to get back to rolling on the mat, or even just certain positions on the mat? Maybe, you could roll with some modifications, but like, I'm normally a big leg locker, and a lot of these entanglements just twist up my hip too much and I can't get accustomed to it. So it's just going to be so dictated on so many different factors that, you can't run these formulaic methods of assessing. You need to have a process, but the steps that you take are going to be dictated by the individual in front of you.
Mm-hmm. So I like what you said about it being very specific to what the person is looking to do.
Mm-hmm.
You're not necessarily telling them what my doctors used to tell me, which was lay off of it for a little bit.
Mm-hmm.
You're, like you said, you have an entry point, you attack from what's tolerable,
mm-hmm.
and you slowly progress after that.
Yeah.
Interesting. Yeah. So we talked about what is tolerable pain.
Mm-hmm.
I'd like to define that a little bit too. What is your definition of pain?
It's kind of borrowed in that I look at pain as an unpleasant sensory experience that is related to actual or potential tissue damage. Because again, you could have pain without any real injury, and conversely, you could have an injury and not have any real pain involved with it too. There's plenty of examples of seeing these things in real life, whether it's phantom limb pain in amputees, or you see somebody that was running across the street, they step on a pothole and they twist their ankle, but a car's coming at them, they run across the street, and they probably have a reasonably catastrophic ankle sprain, but your brain recognized the threat of that bus hurtling at you as a bigger threat, and so you didn't develop any pain from that instance.
That's insane. That's actually, I've never heard of that exact story or like analogy to define pain. That's a really good analogy, if you will.
Yeah. I mean, it's one of those things, again, like pain is something that is very nuanced and it's personal, and it involves so much more than just the physical state of your body and tissues. I mean, your general sense of stress, your emotions, your preconceptions of how these things behave, and even so much more than that, your culture, your religion, these all factor into it. So it's one of those things that you and I could have the same exact tissue injuries, like same exact degree of tearing in a given muscle, and have completely different experiences with it. From both the immediate pain that we experience to how quickly we recover. So
what do you think contributes to that difference in experiences?
It depends. Again, like it'd be hard to pin down like a singular factor. I mean, that's the thing with pain, is that we can't really be reductionist on it. We can't just be like, this is it. Like, this is the one thing that's driving all of this. And again, that's so countercultural to its practiced commonly. We have all these people that dive down these biomechanical rabbit holes and are like, oh, that little bit of dorsiflexion that you're missing, that's just a hair of a degree off from the other leg, that's what's causing your mid-back pain. I'm like, what? Where did you get that?
Wait, so you're saying my mid-back pain is not caused by this imbalance between my right leg and my left leg?
No. And again, there's so much to debunk in these things. And it's funny, especially when we come to lifting weights, where we have these mostly symmetrical movements and people demonize the slightest bit of asymmetry. Yeah. And then you look at somebody like a baseball pitcher who has so much more movement one direction their shoulder than the opposite, than their non-throwing arm, and it's just totally acceptable and fine. And we never really demonize it much. So It's just very funny how like asymmetry is totally fine and acceptable in certain sports, and then elsewhere in our lives, like, no, you have to be perfect, otherwise you're going to develop pain. It's just a very funny thing to me. Yeah.
So I got a little advice for everybody out there then. In that case, if you feel like you lean to one side, you feel like there is a sort of imbalance. We're not exactly saying there isn't one. It's just don't hyper focus on that being the source of pain.
And I mean, and if somebody develops pain over time, it's like that may not be the thing that necessarily set it off, but it's one of those things too that I'm not saying that technique is unimportant either. The technique is going to allow you to have a higher ceiling for what you could potentially lift. And again, if you have less moving parts, it's just one of those things that everything becomes a little bit more predictable. You can more reliably progress something now too. And it's one of those things, even with somebody who is in pain, sometimes they do optimize form because that might mean that we're imparting a little bit less stress on the thing that hurts, which in turn makes things feel a little bit more pleasant. So like I said, there's a lot of nuance in these things. There's a lot of gray area. There's very few hard and fast rules beyond take something that's tolerable or at the edge of tolerance and progress from there. Find your entry point and scale up.
So not exactly avoid it altogether.
Correct.
Because then what would happen would be
you don't have any stimulus to adapt to. The body adapts to stress, and so we need to open up that window for adaptation by actually stressing things. And it's one of those things, like, let's say that you got hurt today lifting. I might say, hey, you've got time, you could end your session now if you want, if things are really uncomfortable, but let's get this tomorrow or the next day. People are generally afraid to. We have that, I need to let my body rest to heal. And that could be true for certain systemic diseases and illnesses. But when it comes to our musculoskeletal system, we need stress.
Okay. So let's assume I'm going to take you back 2016 before Soya BS. I'm lifting in the gym. I'm squatting. I'm using the old method I used, which was load up the plates and fail until one day I magically come up. But before I magically come up, I get hurt squatting 405. What would you advise that hypothetical Jorge, but slightly real Jorge, to do?
Well, what did you hurt?
Let's say as I was coming up, I felt a pain in my back and it's shooting down my leg.
Okay. So in this case, what I would probably do is be like, hey, the most advice I can give you without formally assessing you is see if you can move even just the bar through a full range of motion. And if you can't, then let's play around with, maybe we have you squat to a box. Can you squat to a box at a certain height without considerable amounts of pain? Okay, you could do that. All right, let's start to add weight. And then let's work through just getting some work done here. Let's go up to a weight that you're like, okay, I'm working into a little bit of discomfort, but I'm not outright setting things off. It's not getting substantially worse by any stretch of the imagination. And in some people, that might be all the therapy you need.
Okay.
It might just be, hey, we work with a squat modification for a little bit of time, and then our progression is both weight on the bar and going back to a normal full range of motion squat. In other cases, let's say you've got that pain rating down your leg, and it's getting a little bit more consistent than it normally is. At that point, I'd be like, hey, let's get in. Let's actually suss things out a little bit. And I might look for a desensitizing maneuver where now as you take repeated repetitions of this movement, you're like, okay, I'm feeling less pain down my leg. It's a little bit more intense in my back, but I'm not getting that pain in my leg. So I'm like, okay, this sounds like a great movement for you to do throughout the day to make yourself a little bit more comfortable. And over time, you should, again, adapt to that kind of stimulus.
Okay. So you mentioned again that just to go back to what you said about when you first started off in your physical therapy practice, you mentioned that you were doing a private practice, that you hated it. And let's say this hypothetical scenario, there's a guy who's lifting and he gets hurt. Not Jorge, but sort of Jorge. And let's say it gets to the point where, his YouTube research is remained inconclusive to ailing his pain. Mm-hmm. So now he's decided he wants to go see a physical therapist. How does this person avoid seeing one of those overworked or overwhelmed private practice physical therapists that provide a diluted service versus someone such as yourself, where you only see one patient at a time?
Right. It's tough because, again, so many of these places advertise one-on-one care, but what they don't do is they don't put an asterisk there and say one-on-one care for 10 to 15 minutes of mostly manual therapy treatment and then unsupervised exercise that's set up by a tech. So it's really tough to do that. I think one of the easiest things to look at is this part of a hospital system? If it is, it's likely going to be set up the same way where, again, you're basically being run through a mill. You're in the assembly line clinic. And then if you look at organizations that have many locations, if you've got, I don't want to throw out names, I don't want to besmirch any company and then have one person at the one good clinic that doesn't operate this way. But typically, if you have something that's got like 10 plus clinics, you could bet that, again, they're working in an assembly line. And so typically what I'd say is look for individual practitioners. When you're searching up physical therapy or rehab or any of those sort of terms, look for something that seems to have just one or two people on staff. Look for, I'd even say call and inquire and ask, do you have techs, aides, assistants, etc.? And then, assistant is a mixed term because there's licensed professionals, physical therapist assistants, who could essentially do most of my job. They just can't formally evaluate someone on a first visit. So I'd even be careful with using the word assistant, but, ask, do you utilize techs or aides in your services? How much of my time is spent under the direct supervision of the therapist? But it's so tough because, again, some of these people might lie to you. They might do these things for you in the first couple of sessions and then just, again, put you right back on the assembly line with everybody else.
Jerk offs, man.
Yeah,
all right, well,
it's tough. Like I said, the best thing you could do is just ask around, go through your community and see who's the person for you guys.
all right. So now that physical therapy, so again, he's a physical therapist, right? But he's also Dr. Michael Soya as well. You obtained a major feat in Brazilian Jiu-Jitsu of acquiring a purple belt. You largely taught yourself with like the flow charts and all of that. I was just amazed that you would take the time to watch videos as well. And then obviously you had the help of others who also taught you. So not largely, but I guess partially taught yourself. You also, when you got into powerlifting, I'm sure you were, I don't want to say you didn't get a coach that would train you in person every session.
No.
Right. And I guess what I'm trying to get at is you're also jumping into vocal lessons, singing lessons. So you're a man who does not fear jumping into unknown territory.
Right.
What kind of advice would you give people that are fearful of jumping into unknown territory?
I mean, so much of us just have this fear of not being good at something. And it's very rare that you pick up something with natural talent and ability. Most people would find it hard to believe that I was this height and 130, 135 pounds at one point in time. Yeah. So I was not a gifted lifter. Like I remember the first time that I had bench pressed, I think I hit a 1 rep max of 115 pounds and I tried 135 and immediately just crushed my chest. So I had no natural ability in it at any stretch. And then again, I did eventually end up working with a coach. I went through a lot of different transitions in it. I had done a bodybuilding competition in 2011, and then I absolutely hated how subjective that was. I was like, I need something more concrete. And one of my uncles had competed a bunch in powerlifting. The owner of the gym near my parents' house I'd go to on breaks and stuff like that. Coached for the U.S. national team a couple times. He himself was on it a couple times. And he saw me lifting as I was trying to transition to powerlifting. He's like, hey, I think you might do okay at this. And then he started coaching me for a bit, mostly remote, but every time I'm in for a break from classes from school, I'd go and lift with him if I could. And I got to the point that I had a couple open state records. I had been on the national team twice for the North American Championships. I won one of them, took third in the other. I'd gone to the Arnold. So I got to a high level, and like I said, I took a chance on and gave it its fair shake. So many people are like, I gave this thing a 2-month try. I'm not any good. I'm like, you might need to give it a little bit longer.
How much longer would you say? And I kind of want to pull on that because a lot of people they don't just do it with powerlifting. They do it with a lot of things that they'll give it 2 months. And to some people, 2 months is a lot of time.
Right.
But to other people and to the things that you're trying to accomplish, 2 months is actually a small amount of time.
Yeah, it's not much at all. Particularly something like jiu-jitsu. Like in jiu-jitsu, I think it realistically takes like at least 6 months to develop anything resembling a degree of competency in it. With lifting, it could be a little bit shorter because again, you can more easily test out, hey, let's go for a new max today. And most of the time, even if somebody's only been doing it for 2 months, they're going to be ahead of where they started out by a decent margin. But when it comes to stuff like body transformation, stuff like that, it's a lot less apparent. Even if you're taking good before and after pictures in the exact same room, the exact same lighting, some of the differences are so subtle. So really, those journeys are a lot longer. That's stuff you're looking at 6 months, a year, 2 years. So, and it's easy to get a little frustrated because you're not getting some of that instant gratification. You're not seeing that, washboard set of abs. You're not seeing that magic number on the scale that or that you convinced yourself to believe, if I hit that, my life is going to be so much better.
Yeah.
So it's tough. And then again, like when people fall short, we don't have that sense of, oh, but like, look how far I still got. So many people are like, oh, I didn't make it. Rather than like, dude, you got 95% of the way there. That's pretty cool.
Yeah. So you obviously find physical activities very fun, you know, and you obviously find learning and the process very fun. And a lot of people do have this challenge of becoming outcome oriented and seeking that instant gratification. What advice would you give to somebody to make physical activities fun, especially somebody who doesn't come from a physically active background?
I mean, I wouldn't say that. I played almost every sport. I wasn't good at every sport. Like I could almost barely ever hit a baseball. I was never good at baseball. I was never very good at basketball. And I did give those a pretty fair shake as a kid. But it's one of those things that you have to kind of find what draws you a lot of times. And lifting is one of those activities that generally doesn't appeal to a lot of people right from the get-go. But there's so many disciplines within lifting, whether it's just general fitness, whether it's circuit-based things, whether it's powerlifting, whether it's weightlifting, whether it's group fitness. There's so many different avenues, and realistically, it's just like you have to try them. You really have to give it a couple months and then see, do I like this enough that I could see myself doing it almost perpetually? Because I believe that we need to sustain some type of exercise for our livelihood, for life. So it's really tough to give a really good cut and dry answer beyond go out there and try different things, see what seems to grab you, see what's fun. And for a lot of people too, I think the biggest thing is just having a little bit of support and some community in it.
I love that question. It's kind of like a tough question right at the very beginning of your journey, whatever journey it may be, of ask yourself, can I do this perpetually? Can I do this for the rest of my life?
Right.
And if the answer is no, then you should probably like not do it, right?
But after you've given it some time.
Okay, after you've given it some time.
Right. Like I wouldn't say like, oh, I tried it once, I absolutely hated it.
Yeah.
Because if you look at especially something like jiu-jitsu, like most people after doing the first session where they're getting out of breath just drilling, if most of us had that thought of like, oh, I can't see myself doing this even tomorrow, we'd have a worse retention rate than we already do.
Yeah.
So I definitely think you need to give it a fair shake, at least a couple months, and then reassess. Can I see myself continuing this for a very long time, maybe the rest of my life even?
Yeah. So follow-up question. So what's next? What's next for Dr. Michael Soya? Or Soya?
More of the same, really. It's funny, again, we live in this mindset of more, whereas I'm like, I just want to kind of go deeper. I don't necessarily need more. I'm making okay money, things are being paid for and everything else.
But don't you need more to go deeper?
Sometimes. I mean, it depends on what you want to do. I mean, in my case, it's like my business is doing just fine. I'm having a really fun time with my singing lessons. I'm really liking the process I'm having with jiu-jitsu. My marriage is great. My dogs are awesome. It's like I don't necessarily need more. I'm happy.
Can we get a sample of the singing lessons, please?
No, not today.
I thought we were going to get the district exclusive sample.
No. In a couple weeks to a month or two, I should actually have something out, which would be pretty fun.
Have you done any performing in front of people?
I did once. It was okay. Like a lot of things. Like I wouldn't say I'm necessarily a private person because again, like we all know my whole story of my recent medical experience. So it's not that I'm uncomfortable sharing certain things. It's just more so that every once in a while I'm like, this doesn't have to be seen. But I did do one summer of last year. My singing coach, he does these singing parties or like almost like recitals, and people get to pick one or two songs and perform them in front of this community. So it was okay.
But aren't you afraid of being judged?
And that's part of it, right?
Okay.
That's what happens is that we do it, and it's just like you're in a community of people who are mostly also in the same boat as you. It's almost just like a mix of like rank amateurs to some people who are very good, and nobody's gonna be like going home afterwards and thinking like, oh my god, Soya was terrible. I would never listen to him sing ever again. They might be like, he wasn't bad. He could definitely improve here, and here, but nobody would be outright mean to you about it.
So you're saying that all of those insecure thoughts while I'm at the gym and I'm thinking everybody's staring at me.
Yeah, not legitimate.
They're not legit, right?
No.
People are too focused on themselves to focus on you.
Right.
They're probably thinking the same thing of like, oh, this person might be judging me and what I'm wearing.
Everybody's got insecurities. And what's funny too, especially in the gym, is that you'd be surprised at how many people would be willing to help you. And I mean, give or take whether their advice is actually sound or not, it's a completely different story. But most people would be happy to try to at least point you in what they believe is the right direction if you give them a chance and, maybe ask a question or two.
Damn. Yeah.
Yeah. But again, everybody's just kind of a little wrapped up in their own insecurities, or in the opposite end of the spectrum, just involved in their own narcissism to such a degree that they're like, oh, I'm the only one here and everybody's focused on me.
Has that ever happened to you?
I don't know. I generally try to think I'm a pretty approachable person.
You're a very approachable person. Yeah.
Like I've had a lot of people just ask me general stuff between like, oh, how do I adjust this piece of equipment, to like, what do you think I should do about X, Y, and Z for this given goal?
But have you ever thought to, like, I guess maybe years back, now you're more comfortable in the weight room, you're comfortable in the gym, but years back, how did you overcome that fear of being judged by other people and not knowing what you're doing?
I think just having almost like a sense of apathy about it, just being like, what's it matter? Like, why should I care? Because again, everybody's in there for similar goals, whether it's to be healthier, to lose weight, to deliberately gain weight, get more muscle, get stronger, whatever. We all have like-minded goals. We're on similar journeys here. So what's it matter what I'm doing versus what's the next person doing here to get to that goal?
So yeah, where can people find you if they're looking to get into contact with you?
For professional inquiries, through my website's probably the best, although it's substantially out of date. I do need to fix that one of these days, but that's just soyapt.com. To just chat, Instagram works just fine, at Soya Physical Therapy, or my personals at Soya Sumigaeshi. I don't expect people to spell that right.
I don't even know what that meant. What does that mean?
It's a type of sacrifice throw used in judo and jiu-jitsu.
Sheesh.
Yeah. It's one of my favorites too. It's very fun, just because, again, like, being a bigger guy, it's something that you wouldn't think I'd be able to pull off very well, but I'm pretty good on that one.
I was going to sign off, but what does that look like? What is the throw? What is...
So there's a couple different ways to set up. I like to set it up with a guillotine strangle, and then what I'll do is, while we're both standing and I have the guillotine strangle on your type of front headlock, I'll sit down to one of my hips and then literally kick you over my head and then follow over with it.
Oh, okay. Yeah. Damn, that's insane. Have you had to use your jiu-jitsu in a real life setting? I know you initially got into it because of self-defense.
Yeah, no, I've never had to. I mean, the beauty of it is that it teaches you that you never know who out there is training and who could absolutely just ruin your day. Because I still get beat up by people who are substantially smaller, weaker, less fit than me all the time, because they're just better at jiu-jitsu. They know how to fight better than I do. So, it teaches you to keep a very level head, stay calm, and, talk and walk yourself out of situations. There's no reason to escalate things. People, particularly people who are untrained, tend to have this mindset of, let me just amp up this situation rather than like, let me cool it down. Let's bring level heads back into the conversation. Or if you can't do that, people are just afraid to walk away. We're afraid to back down from things sometimes.
Yeah. So there's a lot of takeaways here today, folks. So again, if you want to contact Soya, just at
soyapt.com.
Soyapt.com.
And then Instagram is at Soya Physical Therapy.
At Soya Physical Therapy, which is much easier than
at Soya Sumigaeshi for my personal.
And folks, if you want to get to contact with the district training facility, contact us at district-training for Instagram, and for our website, teamdistrict.com. And that's all. Thank you. And until next time.
Thanks, Jorge.